Welcome back, everybody. Today we're talking about asthma A to Z, antibiotics versus steroids. Now this is an important discussion to have because for many of us, we find ourselves perhaps in the middle of winter with a sinus infection or a respiratory infection or some other kind of issue at another time of year, and the doctor will prescribe us antibiotics and steroids. They're commonly prescribed together, and today I want to talk about how they're different and why they're often used in tandem. Now, as many of you know, I'm an asthmatic. I live a very healthy and happy life, but every winter I will have some kind of run-in with the cold virus, whether it's just a little bit of a head cold and I have to deal with it and make sure that it doesn't get down into my lungs, or it's a full-fledged respiratory infection, in which case I may end up with some of these in my medicine cabinet. The first one we'll talk about are antibiotics. Now the antibiotics that I have here are called azithromycin. It's called a Z-Pack, and inside this little box there is a pre-set blister pack of 6 pills. They are antibiotic pills of azithromycin. I take 2 the first day and then 1 each of the 4 days thereafter. It's all written on the back of the blister pack telling me which day to take which ones. And of course there are instructions inside the box as well. Antibiotics are a medicine of great contention because many people have discussed how they feel that the use of antibiotics, or I should say the overuse of them or the overprescribing of them for less critical health issues, has caused many bugs and bacteria to mutate so that we end up with things that now don't respond to antibiotics or medicines at all, and that is a concern. However, for folks like myself, for whom a simple cold or a respiratory infection can be life-threatening, antibiotics are something that we often have to take. We don't have much of a choice. If you do have a choice, it's ideal not to take them if you don't have to, because that again just helps with our world's challenge of trying not to allow the bacteria to mutate into more powerful forms. But again, for someone like myself, these often come into play in the winter time. The other drug that I'm often prescribed and use if I'm having a severe lung infection are steroids, also known as prednisone. Now, prednisone is a different kind of drug. Again, a little bit contentious in the discussions around it, a little bit of contention in those discussions because of how steroids are perceived, but for someone like myself, they are a life-saving drug. And prednisone is prescribed to help the body stop overreacting. It's not just for lung infections. It's not just for lung infections anymore. Oh, kind of dark humor there, but I have been prescribed steroids for other things as well. Essentially, anytime the body is overreacting, whether it's overreacting to a skin condition and becoming blistered and swollen, whether it's overreacting to some kind of internal function, whether it's overreacting in the lungs and the way they're responding to lung infection, steroids can be a very important helper, and for myself, in the case of lung issues, lifesaver. So once again, these two drugs do different things. The antibiotics used to kill the bacteria that have invaded your body and caused the sinus infection, caused the lung infection, or something else. And the steroids, which are utilized to help the body calm down and stop overreacting and overstressing itself in the fight against whatever is invading at the time. That allows your body to return to balance and you to get back to better health. Thank you for joining me for this episode of Asthma A to Z, Antibiotics versus Steroids. Please check out my other videos on Asthma A to Z, including everything from food to inhalers and medications. Please subscribe to my channel, share with a friend, and I'll look forward to seeing you next time.